of the primary roles of a chaplain here in the hospice care team is to ensure that there are spiritual support services in place for patients and their caregivers as they make their journey through the hospice experience. And so my role is to provide routine pastoral support, spiritual guidance, really try to be a steady hand in unsteady times. I work with an interdisciplinary group that meets a couple of times a month to where we discuss care plans, the progression of a patient's illness, where we discuss how we might better collaboratively work together to meet the needs of the patient and their caregiver during their hospice journey. Chaplaincy has a religious and spiritual component, but there are several of the caregivers and patients that we meet along our way that come from different faith backgrounds and no faith backgrounds. And what the chaplain needs to do, and what I do in those situations, is just meet people at their point of need. A lot of times people just need to be heard. They're dealing with their own existential issues and questions, and we want to provide an atmosphere of non-judgment where we try to encourage people to just open up and talk about the emotions that they're experiencing and talk about the life experiences that they've had, and try to help them find peace along their journey through hospice. Dying is a very intimidating thing. We're used to living. One of the things that I really want to encourage people when I talk to them or when I begin to meet them as they're getting ready to start this journey through hospice is that it's okay to be afraid, but they're never alone. Their family is there, our care team is there, and we know that this is a new experience for them. And even though it's not a new experience for us, we're sensitive to the fact that this may be a Monday or a Tuesday for us, but these people are experiencing the final days of their life. And so we take it very seriously, and we want to try to be an encouragement to them and help them come to a place of peace and have a good dying experience. And I could say that our administrators, our leadership team, our nurses and our aides, and our supportive services team, they're all committed to that purpose.